We are super excited. This has been a long time process coming to have a freestanding children's hospital. Dedicated space specifically designed and programmed for children. Their own dedicated OR space, their own dedicated ER space, and then a 50-bed children's hospital. So the total children's hospital is going to be 112 beds, including the NICU. So we're just super excited to have Savannah's only freestanding children's hospital. We basically said we want people to come in and feel like they're coming into a 5-star resort as opposed to coming into a children's hospital. Level III NICU is really one of the highest levels of care for neonatal intensive care units. So we're able to do high frequency ventilation, nitric oxide, a lot of very, very specific supports that newborns need. Some of them need them right after birth. We can take care of babies all the way down to 23 weeks gestational age. And so having that capability, we have a neonatal transport team that goes out and picks these babies up from surrounding hospitals and surrounding communities and brings them back here. Some of these babies have to be in the hospital for 3 to 4 months at a time. And so to be able to have all the child life, respiratory care, nursing care, dietitians, lactation consultants, the whole gamut of services that you need to be able to provide for these very fragile babies, we have the ability to do that here. We are the only hospital in the Savannah area that has that. Really and truly the people that operate in there, from the pediatric surgeons, pediatric urologists, the hematologist, oncologist doctors, nursing care, respiratory care, child life, that is such a wonderful thing that we have for children. We have 11 child life specialists. They touch every single area that a child could be in, whether that's radiology, whether that's the OR, whether that's the outpatient services. So the ability to have those child life specialists to help pediatric patients understand what is happening and why it's happening to them is just vitally important. Those child life specialists are able to talk about it on a level that is appropriate for a 3-year-old or an 8-year-old or a 15-year-old, so that they understand why we're doing what we're doing. HCA coming in over a year ago, their commitment to the local community and our surrounding communities in southeast part of Georgia has been evident. They've already spent over $3 million in the NICU, and we're building a $65 million children's hospital. So the capital that they're bringing directly to this area and is going to significantly benefit everybody here is just, to put that into words, is actually very difficult to do.